In this video, we will solve several dosage calculation problems in which nurse is providing pain control for the patient using a PCA pump. A PCA pump stands for Patient Control Analgesia. PCA pump or patient control analgesia orders typically have several components that we need to clarify before we begin solving these problems. Name of the drug and concentration will be on the order. Loading dose, it may be on the order or may not be. It's an optional. It's a one-time dose given to quickly reach therapeutic levels of the medication. PCA dose, also known as demand dose. This is the amount that the patient receives each time they press the button. Lockout interval, that is minimum time allowed between doses to prevent overdose. It can be any number of minutes, 5, 6, 10 minutes. Basal rate, it's another optional component. It may or may not be in your order. It is also known as continuous rate or continuous infusion, delivered regardless of button pressed or not pressed. So it will continuously be supplied for your patient. Now that we clarified some terminology about PCA pump, let's go ahead and try to solve our first problem. Our patient is receiving a patient-controlled analgesia using a PCA pump. The medication is hydromorphone. It is supplied in 6 mg per 30 milliliter syringe. The PCA setting is 0.2 mg per injection or per the time when the patient pushes that button with a 6-minute lockout. 6-minute lockout, like I said when I explained your terminology, it means that the patient will push the button once and then 6 minutes, patient, whether he or she pushes the button or not, the medication is not going to come out. So every 6 minutes, patient is able to deliver a medication to himself or herself, but in between that 6-minute interval, patient can push button a million times, nothing will come out. So that's what 6-minute lockout means. What is the maximum dose in milligram the patient can receive in 1 hour? That's our question. We're going to use DKP method, don't kill patients method. Let's take a look. What is relevant for us here? If we need to know how much patient is receiving in 1 hour, let's see how much patient is receiving. Patient is receiving 0.2 milligram per injection, which is every 6 minutes. Let's write it down. I'm writing using DKP method. 0.2 milligram is, remember it's my is line, it's not necessarily equals because milligrams don't equal to minutes, right? So this is 6 minutes. 0.2 milligram patient will receive every 6 minutes. I want to know how many milligram patient will receive in 1 hour. I can't put hour here because I have to have, using DKP method, I have to have minutes under minutes, hours under hours, milliliters under milliliters. So the same measure goes under the same measure. I'm going to put minutes. Minutes under minutes. So my hour I represented as minutes is X milligram. So 0.2 milligram is every 6 minutes. How many milligram, I don't know, is in 60 minutes. I double check myself. Do I have minutes under minutes, milligram under milligram? Yes, I do. Now I find a diagonal that is not an X. And I multiply these two numbers and I will divide by my third number. In this case, 0.2 times 60 divided by 6. And that equals to 2. And I know I found milligram because I set my X under milligram. So 2 milligram my patient will receive every hour. That is the maximum amount patient will receive. Now look at the problem again. There's other information that was given to us. However, we ended up not using it. Like, for example, our concentration that was given was irrelevant to calculate the amount that patient will receive in an hour. So when you look at your PCA problems, make sure you read the question carefully and understand what is being asked, and then pull the correct information from the scenario to help you solve the problem. In this next problem, the order is to administer hydromorphone PCA, no basal rate, that means no continuous rate where the medication is administered continuously whether the patient requested it or not by pushing the button. We don't have any of that. 0.2 milligram demand dose, that's when patient pushes the button, and that can happen every 10 minutes. What is the maximum number of demand doses the patient can receive in 1 hour? So that's a different question from the previous problem. We're going to think DKP method. Once again, we look at what is given to us and write it out based on what is asking of us, right? The number of demand doses in 1 hour. What do we know about demand doses per period of time? We know that 0.2 milligram per dose, so one demand dose every 10 minutes. We're going to write it down just like that. One dose. In this case, we don't worry about milligrams because that's not what the question is asking us, right? We don't need to find milligrams, so we just put one dose is every 10 minutes. One dose is 10 minutes. We need to find per hour. So per 60 minutes, and the only reason I'm putting hour as 60 minutes is because in this method you have to use the same under the same. So I cannot put hour here. I have to convert my hour to minutes. So 60 minutes. I don't know how many doses will be delivered. I find a diagonal that's not an x. I multiply two numbers and I divide by the third number. In this case, it's 1 times 60 divided by 10. And that equals to 6 doses my patient will receive in 1 hour. And that is our answer. In this problem, we have morphine that's available to us in concentration of 1 milligram per milliliter in 30 milliliter prefilled syringe. And the PCA order has a loading dose of 0, continuous dose of 1 milligram per hour. That means whether the patient wants it or not, 1 milligram per hour will be coming. Demand dose, that's what patient is requesting by pushing the button, is 1 milligram. And lockout is 5 minutes. So every 5 minutes, patient can receive that 1 milligram. The question is, what's the maximum dose in milligram in 1 hour that patient can receive? So here we not only have demand dose, but also now a continuous dose. Let's figure out our demand dose first. Just like before, I'm writing 1 milligram is going every 5 minutes. So per hour, what does it mean for me? So in 60 minutes, that's X milligram. 1 milligram is every 5 minutes. X milligram is every 60 minutes. Multiply on diagonal. Divide by the third number. 1 times 60 divided by 5. 12 milligram. I set my X under milligrams, so I know I got 12 milligrams. That is my demand dose per hour. This is the maximum amount patient can receive if patient will be pushing that button every 5 minutes. 12 milligram. Now let's figure out continuous dose. It's 1 milligram per hour. That's it. So we need to add these 12 milligram per hour of demand and this 1 milligram per hour of continuous, and we'll have our answer. 13 milligram patient can possibly receive the maximum amount in 1 hour if patient will press the button every 5 minutes and get continuous infusion going at 1 milligram per hour. More problems like these to practice you will find in my book, Dosage Calculations, Getting It Right Every Time.